Good afternoon. How is everybody today? Happy Valentine's Day. Well, thank you very much. This also happens to be Heart Month, by the way, February. So everybody can celebrate Happy Hearts Day, right? So anyway, I hope you have a wonderful Hearts Month, Hearts Day, and if you celebrate Valentine's, have a wonderful day. After the town hall is over, we're going to have some sweet treats outside, so if it's appropriate, please grab one and enjoy it. All right, so that's not applause for me, by the way. I just noticed that for the first time. I actually want to take with a slide an opportunity to recognize some wonderful things that are happening. We'll talk more about that in a minute. Talk about some of the media attention. There was a newspaper article today, so I'll talk to you about my perspective on those things. Update you on where we stand with the employee survey. We've made some really great progress addressing what our employees have said to us, so we're going to hear a little bit about that. Talk about some of the specific things that we're doing to try to improve two-way communication. As you all know, our employees have told us very clearly that they want to have a say in what they do, the decisions around what they do, the decisions around what the institution is doing. And so we want to facilitate two-way communication. We'll talk a little bit about how we're trying to do that. A slide to remind everybody that we have a marvelous employee advisory council and wonderful faculty senate doing great work, and talk about them being conduits for communication. Talk a little bit about professional development, talk about financial health, some of the strategic planning issues. And what I want to do with that really is remind everybody that beginning next month, the first week in March, we're going to do the Mondays in March presentations that we've been doing for the past several years. And what those are designed to do is to allow us to update everybody on where we stand with our current plans and then how the current results are helping us think about the future. If necessary, we'll modify our plans based on what we've learned to date with our experiences with current plans. And then questions at the end. So let's get into the discussion. All right. First of all, Dr. Richards here from the School of Nursing. Thank you, Trish. I wanted her to say something about this U.S. News and World Report recognition. It's just great news.
We are just so pleased to have this designation and this honor. We have worked very hard. We've been doing online education for 20 years almost, and so it's been really an adventure. We feel like pioneers, and we hope to improve and make things better as we go along.
So thank you very much. Congratulations to the School of Nursing. I think everybody here is very proud of the work that all of our educators do, whether it be faculty members, staff who support education. We continue to lead the nation in health professions education on so many fronts. So thank you certainly to your faculty and staff, Trish, and thank you, Dean Protis, to the School of Health Professions, Dean Jacobs, the School of Medicine, the Graduate School, Dr. Niesel. Everybody's doing a great job. The Trauma Center has re-upped its Level 1 status, so congratulations to our folks in the Trauma Center. Absolutely. Now, I don't think Ms. Sollenberger was biased at all when she told me that the reviewers just sort of passed through and said everything's great, you guys are doing a wonderful job. She said they did have a few minor recommendations, but again, we're out there setting the pace for Level 1 trauma centers. Is that okay if I say that? Okay, she's shaking her head. So that's good news. Congratulations to our folks in the Trauma Center. Now, something that's very important for us, we've talked in the past about the simulation centers that we have for training our students, residents, and fellows in training relative to procedures and other patient interventions, just patient interactions. We have a marvelous nursing patient simulation center, which we use for a variety of purposes, including the interprofessional education settings we do around patient care. But we also have an incredible surgical simulation center that is really just coming into full utilization. The American College of Surgeons also inspects these sorts of surgical simulation centers, and if appropriate, gives them recognition for meeting their criteria for being advanced, being appropriate to be deemed as a recognized surgical simulation center. So congratulations to Dr. Kim Brown, all of the staff associated with that, Dr. Townsend, and of all our faculty and staff in the Department of Surgery. Great job. We're one of only 4 such centers recognized in Texas. And again, pointing out that we are leaders in terms of education. Our health system, our hospital, has earned recognition from the Texas Hospital Association, a quality award, significant quality award for our efforts to improve sepsis mortality. We've talked about that project in the past, a huge effort, dedicated effort, led by our physicians and staff members to take a look at the factors that result in higher than expected, higher than normal, higher than desired mortality for patients who present to the emergency room in septic shock or who are close to going into sepsis, taking action in advance of patients developing those life-threatening complications and reducing the overall mortality rate. So congratulations again, that's very, very appropriate recognition. The AMA has granted us a Resuscitation Achievement Award relative to the way, their Silver Achievement Award, for the way that we use resuscitation processes to achieve appropriate and high levels of outcomes regarding those efforts. I think we're the first hospital in Texas to achieve that recognition. So that's, again, appropriate recognition of the great work that's being done in our health system, and significant in terms of being the first in Texas. We're, again, leading the way. Our SICU critical care nurses have received the Beacon Award for their work associated with the quality of outcomes. Again, a significant recognition. Congratulations to all of them. Our gynecology minimally invasive center has been deemed a center of excellence. Again, one of only 4 in Texas. So I can go on and on and on and talk about the recognition that's accruing for our educators, our researchers, and people who provide care in our health system. I think it's very appropriate. Perhaps it's a bit overdue, at least from my perspective. Very consistent with our vision. Remember our vision statement, working together to work wonders, to define the future of healthcare, and to essentially be the best that we can be. Well, all of this recognition attests to the fact that we're working to be our best and be the best. We're never going to be the biggest. We're probably not going to be the most well-known, but there should be nothing that stands in the way of us being the best. So please join me for a collective round of applause. So thank you. Great work, everybody. Okay, so things that haven't been so positive. A lot of attention, particularly in the Galveston County Daily News, regarding the departures of Dr. Anderson and Mr. Elger. And there seems to be, and some of our people have told me, based on the way the articles have been written, a concern that we have not handled those well. In fact, if you take the perception to the extreme, that we've been corrupt, that we've turned a blind eye towards inappropriate behavior, and we punish the people who brought forward the criticisms more than we have the people who were the subject of those complaints. And I'm sorry that that's the way that the articles have been perceived. I really don't think that was the intent of the writer. But the way that these have worked is that the allegations have been published. And really, most of the focus has been on the allegations. And the allegations and our investigative outcomes didn't match. So even though the allegations are sensational, even though they certainly attract our attention when we read an article, what's in the allegations is not what we really discovered happened over the course of time. But we also are obligated to keep much of the result, many of those investigative findings, confidential. The Public Information Act actually, in at least one case, requires us to do that. It's a criminal offense, a misdemeanor offense, if we release that information. Now, newspapers typically don't like that exclusion. They would prefer that it not be there, but that's the law in Texas. A couple of things about our process I want you to know. Whenever we have a complaint like this that comes forward, we do our best to investigate it promptly. Typically, our Human Resources Employee Relations group does those investigations. The outcomes are examined. We try to get witness corroboration or refutation or engagement when it's appropriate. It's appropriate in almost all cases. Management, usually at 2 or more levels, takes a look at the outcome of the investigations, tries to sort out what happened, also tries to test the credibility of the complaints as well as the responses, and then come to a conclusion about what's the appropriate course of action. We take into account whether or not there's a history of bad behavior, whether there's any previous documentation of anything inappropriate in any way, and then decide on a course of action. If the behavior's egregious, even if it's a first-time offense, for example, if it's what's called quid pro quo sexual harassment, then termination typically is the only option. That actually, fortunately, rarely occurs here. In these 2 cases, what we did is to take the findings, the complaints, all the information that we have, and I actually flew to Austin. I sat down with Dr. Ken Shine, members of his senior staff, including an attorney, representatives of the Office of General Counsel, and we looked at all the information that we had and thought about different courses of action, and then decided which ones we thought were the most appropriate to pursue. Now, I have to tell you, I was disappointed in everybody's behavior, all of the actors who were involved. I didn't think they were consistent with our core values. We do hold our people, particularly our leaders, to high standards for behavior. To me, that's consistent with the culture of trust that you guys hear me talk about all the time. So in these cases, that's what we tried to do. Now, some have asked me, well, what about this thing about their salaries? Well, actually, both took about a 30% reduction in compensation. The articles don't read that way because base salaries for eventual positions were involved. Those are based on the market. So other people have asked me, well, how come you did these settlement things? Well, we tried to be fair. We also, when we're engaged in potential litigation or litigation that involves going to court for long periods of time, our people being engaged over the course of time in providing statements, being pulled into court, having to go through these processes where they provide sworn testimony. We look at the cost of that, and we don't look at it just in terms of the attorney's fees. We look at the disruption in working relationships as well as the loss of trust that has a negative impact on the function of the work units. And as you can imagine, in these 2 instances, those are critical work units, making important decisions, facilitating important decisions, involved in decisions affecting sometimes hundreds of millions of dollars worth of effort. So in both cases, what we tried to do is to think first and foremost, what does it take to restore the function of those work units? What does it take to restore the appropriate working relationships? What does it take to restore trust? And then move on from there. So, but because our approach, our methods, our decisions are being questioned, what I did with the blessing of the chancellor was to convene this blue ribbon panel, or at least what we call a blue ribbon panel. It's led by Ann Maisel, who's a local leader in an accounting firm. Ann is also the chair of our audit committee. So she's always involved in looking at what we do with policies and procedures and controls. So she's familiar with UTMB and how things work within the UT system. Tom Parrish, who is an attorney by profession, he is the chairman for the Andrews and Kurth law firm in Houston. Leon Leach, Dr. Leon Leach, who is the Chief Business and Finance Officer for MD Anderson. A lot of experience in dealing with large organizations within the UT system, but independent from UTMB, as are Mr. Parrish and Ms. Maisel. I also thought it was important to involve our employee and faculty leaders, so I asked Julie Cantini, who is the current chair of our Employee Advisory Council, Dr. Larry Sowers, who is the chair of our Pharmacology Department, a more recent addition to our faculty leadership team, as well as Dr. Barbara Thompson, who is a long-serving faculty leader here and chair of our Family Medicine Department, to comprise that panel to take a look at these two situations, the way the policies and procedures were applied, the decisions we made, the outcomes, and see if we could have done it better. What needs to change? If we made mistakes, what were they? And how do we make sure that, heaven forbid, these sorts of situations arise in the future, that we don't make them again? So that panel convened yesterday. I expect that they'll have findings and recommendations for us in the next few weeks. I'm hopeful they will. They're being guided by outside counsel, a lady named Shauna Johnston Clark, who is the head of U.S. employment law for what formerly was Fulbright and Jaworski, and is now Norton Rose Fulbright, based in Houston. So they've got expert advice too. So I hope that will resolve this. I apologize that this has had such a negative impact on the impression of integrity at UTMB, but I think that we want to move forward. We'll take a look at what these findings are, share them broadly, and then try to move on. I also wanted to comment on the resignation of the chancellor. Negative for UTMB, I think, if we think a little bit selfishly. Many of you who were here after Hurricane Ike remember that one of the first official acts of his term as chancellor was to show up on our campus and to tour and to talk to our people and express support for our recovery. And then he adopted a position very soon after that to be our advocate, an advocate for our recovery, for restoration of our full set of functions, our mission work, and was a strong voice for that as we moved through that very difficult time. I don't think we can ever say thank you enough to him for his courage. He now tells the story that his advisors at the time told him not to come. They told him it was too controversial, that there were too many questions about UTMB's future. And his decision was, well, thank you for that advice. I have to go. It's part of my job. So thank you to Dr. Cigaroa. I'm excited for him that he's returning to his core set of skills, his practice of pediatric transplant surgery. He loves that. He's continued to do it, to take call during his 5 years of service as chancellor. But please join me in a round of applause for all of Chancellor Cigaroa's contributions. All right, so let's move on to stuff that's really making a difference. So UCount. Last time I had a town hall, which I think was back in November, we reviewed the results. I told you, gosh, they're not what I want them to be. We need to do better. And we actually lost a little ground from the last time we did a survey 2 years previously. And so it's not the worst ever, and I'll show you some statistics about that in a minute. But, I think if we're going to be the best, then our employees ought to feel like we're working hard to be the best. And there were questions raised with the results of the survey that questioned our work to be the best, the way we were approaching it. So we're trying to address those. Just to remind you, our overall response rate was 60%. That's very good. It varied across the enterprise. I think it was about 38% in the academic enterprise, and that's pretty typical for an academic group, to up to close to 90% or 80-some-odd% in some of the institutional support areas. So again, we expect that. It's based on what people do on their current state of function, and so that's all okay. In 4 important areas, we actually saw advances, and I'm very happy about these. Statement, I would like to be working at UTMB 3 years from now. I like the work that I do. I respect the abilities of the person to whom I report. That's very important. Time and time again, both here and in other big organizations, we see evidence that the most critical relationship for any one of our employees is to their supervisor. So if they don't respect and trust that person, it's very hard for that organization to be successful. And finally, also, along with that, the person I report to treats me with respect. That's great. That's the foundation for success in work units. So some people have asked me, because they knew that I was concerned about these results, gosh, these are the worst ever. What are you going to do about it? Well, they're really not. Although, sometimes it may feel that way. Now, we can't track all of the precise information from the survey because we had different vendors and different surveys. But if you go back to the year 2000, you look at the number of people who responded, and then you look at the percent favorable, looking at all of the facets of employee engagement, you see we've had really a nice rise over the course of time. Now, we hit a peak a couple of years ago. We slipped back a little bit from that, but still, these are about average results for an organization like ours. But of course, we don't want to be average. We want to be the best, so we're going to continue to work at this. So a lot of action has been taken. Now, when we started work with the survey done a couple of years ago, we had our consultants come in, we formed very extensive action plans, charged all of our managers across the institution to address these, and turned everybody loose. And as I mentioned a couple of months ago, we only at least documented completion of about 10% of those action plans. And, as we look back at that, we didn't plan very well. We probably shouldn't have followed the advice of the consultant. We should have been more specific and more attuned to the needs of different parts of the organization. And we should have focused more on specific elements as opposed to trying to focus on too many things, particularly given how hard people are working today, how busy they are. So we've tried to correct those mistakes with our approach to the results of this survey. We've tried to make them more specific for parts of the institution, so there's specificity for the health system, specifically for CMC, for the academic enterprise, and for the institutional support units and business operations facilities in the Office of the President. So focusing on those 2 to 3 areas of greatest concern, as you see, and trying to make sure that everybody has had input into the creation of those action plans. And so I actually asked several people if they would talk a little bit about what's been done with action planning and implementation in their areas. So I think Deb McGrew is here from the health system. Deb worked really hard. I want to congratulate her because even before the rest of us were creating action plans, I think she may have been implementing. Yeah. So Deb, thank you for taking this very seriously and helping the health system address the issues.
Thank you, Dr. Callender. So the update from the health system is we've done over 170 employee feedback sessions and have collected more than 1,800 comments and ideas from our staff on the 2 focus areas. From that, we've developed an action plan using those ideas that we gathered that focus really on 3 main points. First is management leadership presence in the environment. So are we available? Are we there supporting our folks delivering care each and every day? So we have action items focused on that. Communication, which you mentioned earlier. So how do we target communication more effectively to connect our staff with what's happening in the organization and what they need to know is changing in their environment to effectively deliver care? So we have action plans around that as a theme. Reward and recognition. So how are we giving people pats on the back and helping recognize the great value they bring every day with their work and in their service for our patients? So we have some tactics around that as well. And then finally, particularly in nursing and some of the other professional disciplines, we're looking at our staffing patterns. So do we have the right mix of staff? Do we have the right number of staff? And how are we communicating our staffing models so folks understand where they were derived, how we're benchmarking against other organizations, and what they can expect from that staffing pattern. So that's been the focus of our work. We roll out our plan in 2 weeks to managers and directors and are already rolling on a number of the tactics.
Very good. Thank you very much. Dave Anderson, you want to talk about the academic enterprise response?
The academic enterprise has developed action plans and specific tactics to address two focused areas in the UCount survey. These areas were communication and employee satisfaction. The guiding process for desired improvements in these areas has included the following activities. Leadership teams in all 4 schools, nursing, health professionals, graduate school of biomedical sciences, and medicine, have identified school-specific priority areas towards improving communication and employee satisfaction. 2 pulse focus groups representative of a cross-section of faculty and staff from both departments and centers in the academic enterprise recently met to develop an array of specific action items and tactics in these priority areas. The focus groups were objectively facilitated by Ms. Trish Wooten of UTMB's Organization and Workforce Development. Several areas identified by these pulse groups have been immediately transferred into Academic Enterprise Vision 2020 strategic planning process, which is also known as the CIRA engagement, which many of you have been involved in. And work plans are being created in the following areas. First, to establish communication standards and expectations for use throughout the academic enterprise, such as toolkits for managers and resource references for new employees and staff. Second, to create career development programs to include skill building and refresher courses for all levels of staff across the academic enterprise. And third, to enhance mechanisms and systems to retain staff in such areas as performance appraisals and auditing so that there's more consistent administration in the evaluation process. Finally, the actual measurement towards individual unit success in achieving improvement in these priority areas will be developed by the Academic Enterprise Nexus Group, which is a recently formed internal consulting group of UTMB faculty, many of which have postgraduate training in such areas as MBA, MHA, and Master of Public Health. These internal consultants will provide technical recommendations that will assist the current operational units of the academic enterprise in measuring the desired changes in these areas.
Great. Thank you very much, Dave. Wonderful work. Todd, I think I actually didn't mention information services. I should have earlier in terms of really taking this seriously. You've certainly led personally in thinking about the appropriate response to the survey results for information services. So please tell us what you guys are doing.
Yeah, so we took, similar to the health system, we took an approach that maybe for the first time ever where we said, all right, we want to make sure every employee in information services really had at least one opportunity and hopefully multiple opportunities to provide us feedback. I think sometimes when you respond to these kind of things, you think, well, we've got, as managers or leaders, we've got to come up with these fancy things that our leaders are going to say, that sounds pretty good. And I think this year, maybe for the first time, we just said, hey, let's just listen to what people want us to do and maybe do that instead. So I think it was a big, and so, which is shocking. It seems so, I thought I was going to say something brilliant, but the other thing I would say is that we focused on really 2 areas as well. Communications, obviously, you can never really do that well enough. Many of the same things, from everything from me being more visible into all our units, and as many of you know, we're spread. About 20% of our department is sort of spread out around the state of Texas, so it's hard to get to everybody there. And then the rest of our department certainly is spread around, Clear Lake to campus. And so, if I have to step out of more meetings and be with the staff more, I'm all for that. So I just want to be supportive of that. On the staff development side, as you might imagine, our, for the technical teams, it really is about getting technical training. So, in previous years, we spent a lot of time on career development plans and stuff like that. I think they kind of told us, well, those are nice, but the reality is, can you just get us to more technical training so we have the skills to deliver for our customers? And so I think the team's come up with some really creative action plans to get more people to training, actually make time for them to train. As all of you know, we're all so busy. When do we expect them to do these things, and aren't we going to treat those things as important as all the projects we're working on? So you'll see our action planning sort of address some of those issues as well. But again, I'm very optimistic this year, more than maybe most, that the changes we made are going to result in some real changes and some real benefits to the environment. So it's been a great opportunity.
Thank you, Todd. Outstanding. Finally, Mike Schreiner, Business Operations and Facilities.
As you can imagine, we tackled similar topics. The two primary topics we saw were the need to improve communications and employee development. And so in the communications aspect, we went out and looked at and talked to 20 different employee units in the November-December timeframe, talking about what it is that those employees are seeking in terms of communication. What are they not hearing? What would improve that? And it was really a pretty simple answer. We do a lot of meetings like this with our employees, 100, 200 at a time. That's not a great opportunity to communicate. What we really need to do as leaders, at least what we heard from our employees, was commit more time to spend time with smaller employee groups, smaller groups of employees, and actually have some conversation about what's going on. And what's going on at UTMB, as a leader, what can we share? What's happening today, what's going to happen in a couple of years, but also, from an employee standpoint, what's happening in their lives, what should we be aware of, what can we help with? So in the intervening time then, from December to now, we've begun a series of those sort of small group meetings. And from a leadership standpoint, we are committing more and more of our time to that and less to the larger communication forums. We hope that will certainly address one of those needs. On the development side, what we heard is that we need to see some more linkage with the employees' development plan to the UTMB plan. So if UTMB is going to do all these great things in the next 2 years, 3 years, or 5 years, where do the employees fit into that from a personal standpoint? What's in it for them? And I think that's a very fair question, and it's only right that we can have that dialogue and talk about it. We've got 3 people here today. I need to have them stand up. I want to make sure I introduce and recognize them. Dennis Ford, you'd stand up, Dennis. Andrew Best and Russ Roadcap. These are our program managers for property services for the campus. Can we give them a hand? This team did a wonderful thing. They put together a certification program that was brought to us by the American Hospital Engineering team, national office. They initially developed it for a small group of people, and over the last 12 to 18 months, we're able to deliver it here in Galveston. But it turned out to be hugely successful and served a much, much broader audience than we ever started out to do. But I think it's a great example of how we can bring resources to bear for development and improve the skill sets of our employees. And it's skill sets that they own, that they take with them. And that is a good thing for all of us. Russ, could you give us just a couple ideas of the numbers and the programs you had going there?
Thank you. So anyway, about 2 years ago, we Property Services, we engaged ASHE, which is the American Society for Healthcare Engineers. We challenged them to break the industry mold, bring training to UTMB. So and typically what we would do in the industry is we would fly around the nation and we would attend various training seminars or courses. And as a result of the training, we would go out and be prepared for various certifications. So our challenge is we wanted to become certified healthcare facility managers. So what we did is we brought the training here to UTMB. Over the last 2 years, we've roughly put in about 30 to 35 people, pipelined through this training. And as a result, we're looking at over a dozen people that actually certified in the CHFM credentials. So that was outstanding. In parallel with this training, we've got about half a dozen individuals that are plugged into either higher education programs or some type of college course or just self-improvement courses. So it's been great for the last 2 years. Thank you.
So again, we appreciate the efforts of our leaders, people like Russ and Andrew and Dennis. And I would just tell you that the effort that they put forward has now become a national best practice. Those national organizations didn't do this before, but they have now figured out that this is the way they need to be supporting our employees and staff across the country.
Great. Thank you very much, Mike. And thank you to Andrew, Russ, and Dennis for thinking about what was required, how we might do it better, making the process more accessible, and advancing the skills of our people. Really nice work. That's the sort of thing we like to see. All right, so we've talked a lot about communication, how we improve it, and as Todd mentioned, it's always a challenge, particularly in a big organization. And we put all sorts of information out there through different sources. But the real challenge is how do we connect with everybody? Because everybody works a little differently. We know not everybody has access to a computer. In fact, a large number of our people never see a computer and have a chance to interact in any way. So what's the best way to deliver information to facilitate two-way communication? Still is, as I alluded to earlier, through that person's supervisor and with their fellow employees. So we're thinking more about this, how we can channel information more effectively, particularly to that nexus of communication, how we make it easier for supervisors to gather information that they can deliver or should deliver to their employees, how they actually take the feed from their employees and move it into the rest of the organization. So we're looking at a lot of options. We are intent on improving the two-way communication, and more to come on that front as we move forward in the coming months. These are just some of the things that we've been doing already. As you know, we've got UTMB, our homepage that's out there for people who can't access a computer, the impact message that goes out, daily announcements. We actually have Facebook and Twitter feeds for those of you who didn't know that and use those regularly to communicate about things that are happening here. On occasion, I or the other executive leaders will send out global messages regard to big concerns or big issues for the institution. I continue to travel around and meet with small groups. Lately, my focus has been on trying to translate the road ahead document we have with the institution's plans into what Ms. Sollenberger originally dubbed, now we're all using the phrase, as my road ahead. So essentially, the plan for each individual employee, including development opportunities. That's a concept we want to further develop in coming months, and hopefully I'll get to see almost everybody in the institution over the course of time as we make this effort. The Employee Advisory Council has been very kind and shepherded me around the various areas of the institution, in effect creating open office hours so people could drop by and talk. Depending on the time of day and the site in the institution, we've had pretty good success with that and continue to think about how we can make that a useful opportunities for our employees who work in different areas of the institutions. Dr. Jacobs has instituted the fireside chat. I understand he's gotten a great response with that, an opportunity for people to come sit down and talk and have concerns addressed, for him to explain what's going on in the academic enterprise, and probably most importantly, the whys behind the things that we're doing, the decisions we're making. He has a regular blog now that's posted out. He also has started a new exchange forum called It's Just Lunch, where faculty members are invited to come sit down with him, and it's pretty much an open forum where they can talk about anything that's on their minds. And it's a great opportunity to speak directly with the dean and provost. Ms. Sollenberger has regularly had brown bag lunches. Those have varied from topics of personal interest to her, members of her leadership team, to bringing in outside speakers who come in and talk about current topics in healthcare. From my understanding, they are very well attended. They're very popular, and I think you have plans to continue doing those as frequently as you can. There's the Health System Friday Focus, which regularly comes out, the Flash Report, which talks a little bit about operating statistics. So a lot of information. There's no shortage of content. The challenge for us is to make sure that it's available when people need it, and it's available in a very useful form. So the one thing, I mentioned this earlier, I wanted to remind everybody that we have this marvelous group of employees who constitute the Employee Advisory Council. And they continually look at how we're working with employees, working conditions for employees, overall environment, issues such as communication, and are a very important resource for all of us. Not only can an employee anonymously take issues to the Employee Advisory Council, but can also make suggestions for ways that we can improve the ways that we work. So I just wanted to remind everybody about their service, their accessibility, and ask our employees to use the Employee Advisory Council focused on ways that we can make UTMB a better place to work. Same goes for the faculty with the Faculty Senate. We have an outstanding Faculty Senate, marvelous leaders who comprise that group. They're very much engaged with the faculty here, thinking about the environment for our faculty. You know, it's a tough time, as we've talked about. A lot of change, not just in healthcare, in research and in education. A lot of things forcing us to think about working differently, and that's always hard, particularly when we have to coordinate changes with our colleagues. So the Faculty Senate's a very important forum. It's a source of information, a source of communication. So I just wanted our faculty members to be aware of that and use that resource again, to try to make UTMB a better place to work. All right, the other thing that we heard with the survey is that we don't provide enough professional development opportunities, or we don't provide professional development opportunities in a way that they can easily be accessed. And we've looked into this, and I think it's a very valid criticism. No blame there. It's just that we haven't made development opportunities readily accessible for our people, and we really haven't matched the development opportunity availability to the needs of specific work groups. So now, as part of the overall My Road Ahead approach, what we're trying to develop is a list of development opportunities for every work group in the institution. Opportunities that are pertinent to the skills or personal development of people who work with that group. Now, we're early into that course. We still have a lot of work to do, but there are some things that the existing development opportunities are out there. We're now looking at how those apply to every work group. Those are listed on the UTMB HR homepage. We've got some new resources that are coming online. School at Work and expanding career and healthcare opportunities are new approaches that we'll incorporate at the beginning of the next fiscal year. I think that's right, Dr. Baird. Is that correct? Okay, so beginning in September of 2014, later this calendar year. And then we are beginning in April, kicking off something that, we should have thought about earlier. We didn't. And that is the desire of many of our people to enhance their software skills. We've had some availability of formal training to do that, but clearly not enough. And of course, we've got Galveston College right here. And they do this all the time. So beginning in April, we've got slots for about 500 people initially, so we can do a pilot program, either bringing Galveston College professors on site or trainers on site, or sending some of our people to their new training facility, which is in the old auto dealership up on Broadway. So I think that's going to be very popular. Obviously, we want to learn how to make it most appropriate, but I'm excited that we're bringing those development opportunities or these development opportunities online. And if you have additional thoughts about other things that we need to make available, please let us know. We want to respond to this need. After all, personal and professional development will make us a stronger organization over the course of time. Some people have asked me to talk about where we are in terms of finances, because I have regularly said, all of you know from reading everything that we read, that sources of revenue are more and more constrained all the time. There's less revenue per unit of service, whether it be education, research, or patient care, than there has been in the past. And that trend is not likely to change as we go into the future. So how do we respond? What are our plans for a response? Well, our plans for response are actually incorporated into the road ahead, and more specifically into the institutional priorities list, a subset of the road ahead goals that we pulled out for everybody to see. But this is just sort of a snapshot of the sources of revenue. Some people have said, why do we worry so much about clinical revenue? Are we too much focused on that? Are we thinking enough about the other sources? We're thinking about all of them, including philanthropy as we go forward, because we'll need to tap everyone that we can if we're going to be able to continue the current breadth of mission work that we do in education, research, and patient care. But you can see that patient care makes up a huge percentage of revenue. And unfortunately, as reimbursement diminishes per unit of service, it's harder and harder to do that. I think most of our research faculty know that for every research dollar, and this is on average, for every research dollar that we bring into the institution has to chip in another 30 to 35 cents of its own money to support that research. And so we count on patient care revenue and philanthropy and a few other sources to help us offset the cost of education and research that aren't funded by state sources or federal sources. And so as we go forward, we're thinking about how we take the greatest advantage, if you will, to pursue all sources of revenue. And that's why revenue continues to be a focus of our plans. So, I know there's concern, well, maybe we're too much focused on revenues, but it's like that old adage, no margin, no mission. We can't educate as many students, we can't do as much research unless we can gather that revenue that supports our mission work. So to that end, we've actually been doing very well. Our staff, our faculty, our managers are very good in terms of using resources. They manage all the time. They take a look at current operating conditions and adjust our plans as is necessary so we can continue to support our mission work. We think we can continue that. As you know, you've probably seen the recent communication. We plan for merit increases that go into effect the 1st of March. We continue to be very competitive in terms of research funding. Our research faculty are doing a very good job. Essentially, our research funding is holding steady while many other institutions have seen double-digit percentage decreases in research funding. So we're all very happy about that. We're doing a lot more marketing. We know that we need to do that. We need to talk more about the excellence that's available at UTMB in our health system. We need to talk about the expertise of our faculty and staff. So you may have seen the ads that are out there. Some of you may have seen the magazine ads in the Southwest Airline magazine and the United Airline magazine. I just want to show you some of the marketing that we're doing. We've got a couple of video clips that are serving as the basis for some of the video marketing we're doing. So could we run those, please?
Through thick and thin. I like that about the doctors at UTMB. I am a wife and a mother. I've got 5 children. When you're a parent and you have a family, you're going to try to make the very best medical decisions for your family that you possibly can. 4 years ago, my daughter had a really bad bellyache. We went to her primary care facility. Dr. Rogers immediately sent us over to the ER, and actually we went into radiology and they did a sonogram and in pretty short order decided that she needed emergency surgery. I completely trusted that we were going to come out of this and she was going to be just fine because I trust UTMB and I trusted the doctors. I trusted Dr. Haver. She had a great recovery and she's doing great. Knowing that I have UTMB and a great family of physicians gives me a lot of confidence in knowing that when something like that happens, even though it's a little bit scary, they're going to be safe and they're going to be fine. Well, it gives you a lot of confidence to know that your family's in good hands and that they're going to take really good care of your most precious people. I was just so proud, really, to be a part of that UTMB family. You know, we do have options, but it's nice to be able to have UTMB here, and it's nice to be able to trust them. I trust UTMB with my family. There's no question about that. I have and I will. UTMB Health, working together to work wonders for my family.
We have been married for 33 years, almost 34.
Yep.
Is that right?
You got it right.
Yeah, I can see. We go everywhere together.
China and Alaska.
Spain, New Zealand.
Even surgery at UTMB.
No kidding. Last year, we both had surgery. I had some polyps removed.
I had a carcinoid tumor removed from my stomach.
And everything went well. I think one of the main things is that all of the doctors take the time and really listen to what you're telling them.
We have choices in our healthcare. We could have gone anywhere for treatment, but we chose UTMB.
You're not rushed, you don't feel rushed, and they answer every single question.
The team of doctors at UTMB are wonderful, and what we found out is that they talk to each other. They do it as a team, and I'm impressed by that.
We felt that everybody really took the time to get to know us and to understand what our concerns were, and it was just very compassionate.
What we got is a sense of well-being, knowing that we have good health and we have access to good health in case something happens.
Can we just stick to vacations?
UTMB, working together to work wonders
For us.
Pretty good, huh? Well, our approach is that we want to be able to characterize what we do well. We are high tech. We have tremendous expertise. So do a lot of other places. What we do extraordinarily well is bring it down to the human level. Make it personal. Make it real and enable people to make really good choices about their health care. And many of our patients are willing to talk about that. That's what you've seen here. So we're going to use this approach for a while, and it certainly makes me proud that patients are willing to step up for us. These are real patients. So I hope it makes you proud too. All right, quickly, construction update. You don't have to look far to see that the Jenny Seeley is on track. The clinical services wing is on track. Our construction workers continue to make tremendous progress with those facilities. We anticipate that the clinical service wing will be ready on time in 2015, the Jenny Seeley on time in 2016 for occupancy. The specialty care center addition, the small hospital inpatient unit up at Victory Lakes, is also coming along nicely. So we anticipate being able to occupy that facility in 2015. We have a number of new sites for clinics, outpatient clinics, that will be coming up over the next year to year and a half. We have Alvin, a family clinic in Alvin. We have a Texas City clinic, which will accommodate primary care as well as some of our specialties. We have a new pediatric outpatient clinic and urgent care facility that will be coming up on the Target Home Depot site, the very western edge of that here within the next 6 to 8 months. And then we have a marvelous new facility we're very excited about that the Seeley and Smith Foundation is developing for us that will go in that space behind Randall's on 61st Street, which will be a home for primary care as well as some of our specialty clinics. So new developments coming along, everything moving forward. We're responding to the increased demand for our services, and I'm very excited to tell you everything's on track. Now, finally, as I mentioned before, we're always concerned about being the best. I think most people work here because they want to be part of being the best. They want to be part of these plans. They want to make a difference, as people have been making a difference at UTMB for almost 125 years. So we continue to make extensive plans for the future. They can sometimes be overwhelming if you look at them in the aggregate. But we think that everybody has a role here, everybody has a place, everybody has their own plan, and together our plans make up the opportunity for us to continue to lead in health professions education, research that improves diagnosis, treatment, and prevention of disease, and the effort to not only set the cutting edge in healthcare, but to move it forward, to advance it over the course of time. So thank you all for your many, many, many contributions to that effort, for your hard work. I know everybody's working very hard. We appreciate it, and I truly believe we're making a difference. If you want to hear more about the specific plans that we have and how we're doing in the major areas of the institution, with the health system work, with the academic enterprise work, with the institutional support groups, and then also I'll do a little wrap-up at the end, please come to one or more of our Mondays in March sessions. Those are scheduled for 3 of the 4 Mondays in March. I look forward to seeing you there. Thank you all for coming today, and I'm happy to address any questions that you have. The question is, how does the Obamacare Affordable Care Act affect our financial position? In general, Obamacare is just one of the things that's impacting the changes, or it's one part of the changes in the overall healthcare system in this country. We continue to look at that piece of legislation, what's occurring with the national insurance market, which is what that piece of legislation predominantly affects. And the bottom line trend is that reimbursement per unit of service continues to fall. And so we need to become more efficient. We need to work together more effectively. We need to be able to produce high-quality outcomes regularly. That's what everybody is moving toward. Reimbursement, we believe, to a large extent, will be based on the quality of outcomes and not on just an encounter. We won't necessarily get paid for a patient coming to see us. We'll get paid for restoring their health to a pre-agreed level with the patient and the payer organization. So Obamacare is just, or the Affordable Care Act is just one part of that. The big trends, though, seem pretty clear, and our plans accommodate the changes or help us make the changes that we need to make to accommodate that future. Thank you. Other questions? Raymond, I know we have a few that were submitted.
Yes, sir. The first one says, the Fair Labor Standard Act requires employers to pay overtime eligible employees for time outside of work when they read emails, etc. So how can UTMB require nursing to complete CCAPs on their own time outside of work and not receive reimbursement?
Yeah, thank you. And I actually read this question in advance, and I don't quite understand all of the nuance. But what I'm told is we actually changed our policy back in October to accommodate on-site training, to pay our people for receiving the training that we require associated with CCAPs. There are some exceptions relative to training that people choose to pursue on their own outside UTMB. I think the best thing for me to do is to refer people to Dr. David Marshall or to Deb McGrew for specific questions about this and our response. But essentially, I think the concern has been resolved with that policy change.
There's another that came in from CMC. It says, I would like to know why the CMC nurses are not eligible for hazardous duty pay.
Because it's against state law, unfortunately. There's specific code about who's eligible for hazardous duty pay. And now, I added my personal editorial there. Unfortunately, our folks aren't eligible. That's the way the state law is written. But what we try to do is to accommodate for that, for making sure that we have market-based pay for our CMC people. The people who work in CMC know this has been a huge issue for us because when we set the compensation rates for our CMC personnel, we can't just do it on our own. We have to have the concurrence of our colleagues at the Texas Department of Criminal Justice, and typically we have to have the approval of the legislature. The money has to be appropriated. There has been no money appropriated until the last session for providing any sort of increase for our CMC folks. We did get that appropriation. We advanced the compensation rates, but we still have work to do, and we'll continue to go back to the legislature in collaboration with our colleagues in the Texas Department of Criminal Justice and try to make sure that we're at the market rate for compensation of our healthcare workers who work within the prison system.
You have time for another one?
Does anybody else have one here in the audience? If not, we'll do one more that was submitted.
And this one was kind of timely. During the time period of potential inclement weather, I would like to suggest that senior leadership make a decision further in advance of the potential event. Perhaps you could make a commitment to faculty, students, and staff that decisions and communication of those decisions related to attendance due to inclement weather would be made no later than noon on the day prior. It allows everyone to make necessary arrangements in both their professional life and their personal life. I believe this would go a long way in letting everyone know that leadership really does care about us. This could manifest itself in the results of the UCount survey.
Well, thank you. The weather decisions in some cases are relatively easy, like when we know we have a hurricane bearing down on us. Now, not everyone may agree with me, but with these last two potential ice storms, we got it right when a lot of other people got it wrong. And we rely on the special relationships we have with the forecasting agencies to try to get it right. The biggest challenge that we have, though, is no matter what's happening with the weather, some of our patients show up to be cared for. And we've tried in the past to notify them, tell them we're going to be closed when the schools are closed, because that makes it a lot harder for a number of our people to get to work. They come anyway. So our approach now is to remain open when it is at all feasible to do so. We tell people, our people, if it's unsafe to travel to your place of work, don't. But we also know that with our outpatient clinics in particular, those on the mainland, that a number of our people live close enough to the clinics, they feel comfortable getting there under almost any circumstance. So our approach now is to try to operate our outpatient facilities as much as we can. We pretty much have to keep our inpatient facility open all the time and staff it as we can. Sometimes if people can't get over the causeway, we ask people to stay until they can be relieved. So it's a complex set of questions for us and issues. We certainly never want our employees to be unhappy with us. We understand individual circumstances are different. We never want anybody to take unsafe chances when they travel. But we also have an obligation to our patients to be there when they show up, and that's the overriding concern. We always try to make the decisions as soon as we can, but as you saw with these potential ice storms, those forecasts were changing till the very last minute, and the forecast, at least from the National Weather Service, which we use, but we use other forecasting services too, were actually wrong. And that cost the school districts quite a bit, and now they're having to make up for that bad decision. They probably wouldn't think it was fair for me to say bad decision. It was based on good information. It just wasn't consistent with what actually happened with the weather. So I apologize to the school system folks. All right, so we'll stop right there. Thank you all for coming today. Again, thank you for what you do. Have a great Hearts Day.
Working together to work wonders for my family.